The broad outlines of the federal management team's plan of action for the Department of Mental Health and Substance Abuse calls for hiring 118 people, maintaining four-bedroom residential homes and 2 clusters of studio apartments, with the centerpiece being the construction of a community center, all within the next 3 years. Federal Manager Dr. James Kiffer says the aim is to provide a totality of care.
From high supervision, those who need it, and those would be the more severe cases over, and the ones that can be progress through and at their rate too, and it will be all individualized, and the training and skill building would be individualized at the center, right. And to the point of having these personal care attendants who might assist them a couple hours a day in their own apartment.
The cost of all that the federal management team wants to do is in the neighborhood of $25 million.
Price tag for the facilities, the residential care, and the professionals is $15 million, and then the center, we're not sure of the exact price tag on that since our estimate's about 12 months old. We need a contractor's estimate before we really know what that's going to cost and get furnished, and so that could be, I think we're in the neighborhood of 24, could be as high as 25. That's true.
The costs for at least $15 million of the plan will be staggered over the course of the next 36 months, and it must be borne by the cash-strapped government of Guam.
The judge was very concerned with regard to hitting the government with a large $15 million turn it over next week type of an order. So she has spread it out in increments over the next 36 months, heavily loaded though in 2011 to get everything rolling, and that's where we'll bring most of the professionals and doing some of the other construction work other than the center.
Kiffer says he and fellow manager Jim Casey have briefed GovGuam officials, and they believe the cost should be manageable.
I think the government can find this money. We've talked to senators, most of the officials, and we talked to Adelup. I mean, people are aware of what we're doing. They've been aware for some time now, and no one has indicated that this is an impossibility.
But beyond the cost, Kiffer argues it's the right thing to do for those most in need.
That's where we want to take it, that they can, that the individuals with problems are identified, that treatment plans are written, that services are provided, and they progress through a system, so to speak, into living in the community as independently as possible. And that's our hope.
Kevin Kerrigan, PNC News.